This is Kathy Knipfer, instructor for Nursing 2313, recording the community-based nursing lecture for Chapter 4, Family Care. When we define family, we know that it is the basic social unit in society. Traditionally in America, it is the nuclear family. In other countries, it often includes the extended family. For purposes of community-based care, it is the individual and the family that is receiving care. When we care for patients in the community, we know that family is those the client identifies as family or significant others. Family health was defined in 2010 as a dynamic, changing state of well-being, which includes the biological, psychological, spiritual, sociological, and cultural factors of individuals and the whole family system. There are several models or approaches to family nursing care. One is the family as a context. With this model, the individual is the focus and the family is the context. Another model focuses on family structure, function, developmental stage, and interpersonal interactions. With this model, the nurse focuses on how these influence the recovery of the client. Another approach is based on the family as a system and/or a unit of service. With this approach, the nurse focuses on strengths and health needs of the family to improve its collective health. Another approach is based on the family as a primary unit of society within the larger community. This approach focuses on the interaction between families and community agencies. We know that family care is significant. Healthy People 2020 is considered a roadmap to improve the health of individuals, families, and communities. The goals are consistent with family health and care, and many of the objectives are specific to families and homes. If you look at box 4-1 on page 80 in your textbook, you see that Healthy People 2020 includes family implications. There are many different family structures. One is the nuclear family. This generally is married couples with children, or it could be unmarried, heterosexual, or same-sex couples with children. Also the nuclear dyad, which would be a couple, married or unmarried, heterosexual, or same-sex. A single-parent family would involve one adult with children. They may be separated, divorced, widowed, or never married. The single adult family structure includes only one adult. Multi-generational family structure would be any combination of the first four family structures. A kin network would be two or more reciprocal households that are related by birth or marriage. Family roles are defined as an expected set of behaviors associated with a particular family position. These roles may be formal or informal. The formal roles are defined by cultural expectations and are associated with roles such as partner, wife, husband, mother, father, or child. Examples would include breadwinner, housekeeper, child caretaker, financial manager, or cook. Informal family roles are those that are casually acquired within a family, such as the person who takes out the garbage. Now, when we talk about the sick role, we know that health and illness behaviors are learned in the family of origin and cultural affiliation. Each family acts out the sick role differently. During illness, various family members' ability or willingness to take on a different role facilitates adaptation or return to homeostasis. Role conflict occurs when the demands of one role are in conflict or contradict with another role. Role conflict may also occur when one family member's expectations conflict with another's expectations. Family functions are divided into several categories. The first is affective. It is the ability to meet the psychological needs of family members. The second family function is socialization. This is the process of learning to adapt to life within the norms of a family and community. The reproductive family function has to do with procreation. The economic family function has to do with allocation of adequate resources for family members. The healthcare physical necessities family function is about health and lifestyle practices and the provision of material necessities. With the family systems theory, the family is defined as a collection of people who are integrated, interacting, and interdependent, where the actions of one member influence the actions of other members. The family system has a boundary that is selectively permeable according to the family's wishes and strives for equilibrium. The nurse's role is to assist the family to return to their normal state of functioning. Competence in using the nursing process with families requires different skills and knowledge as compared to the care of the individual client. When we care for the individual within the context of the family, one part of the family cannot be understood in isolation from the rest of the system. A family structure and organization cannot be understood in isolation from the rest of the system. A change in one part of a family system affects change in other parts. Communication patterns between family members are essential in the functioning of the family. As nursing has moved away from task orientation, it has adopted a more holistic view of clients as individuals with a life beyond their illness, injury, and hospitalization. We can view family functions in relation to Maslow's hierarchy of needs. According to Maslow, the family must first meet physiologic needs before members can consider any other opportunities in life. So now we'll move on to assessment of the family. Of course, the family assessment begins with an interview. Trust has to be established first. A short period of informal conversation at the start of the interview may put those present at ease. It's helpful to have all the family members present. Your textbook includes one assessment tool, 4-1 on page 89. It's the Family Assessment Guide. The family members would be listed. A genogram and an Ecomap may be set up or established. You would discuss family strengths and conduct a developmental assessment, a structural assessment, a functional assessment, and then ask questions to determine the presence of characteristics of a healthy family. So, what are the characteristics of a healthy family? Well, there's open, direct, and honest communication. Members are able to express their self worth with integrity, responsibility, compassion, and love for one another. Everyone knows the rules. Members have individual freedoms. The family is linked to society and they participate in community activities or various groups and clubs. So we know that the same principles used when interviewing an individual client would apply to the family interview. As stated earlier, trust establishment is important with the family as well as with the individual. And we want all the members of the family to be present if possible. Numerous family assessment tools are available. Your textbook has one that's comprehensive. But the family interview allows the nurse to identify family strengths, problem areas, and the need for additional assessment and referral. When we do a developmental assessment, we know that there are predictable stages within the life cycle of every family, and each stage has developmental tasks. When the nurse completes a developmental assessment, the nurse has to determine the family stage based on the oldest child's age, and you can look at table 4-3 on page 96 and 97. But remember to use the oldest child's age for the family stage. The nurse would also consider the family member's health problems in the context of the developmental stage. The nurse would determine if family members are meeting tasks of the stage and identify nursing interventions that assist the family in meeting those developmental tasks. When we complete a developmental assessment, we have to take the stages of the family life cycle into consideration. The first stage is forming a partnership, where the couple makes a commitment to one another. We would want to help them identify their strengths and assist them in developing a strong relationship. With this childbearing stage, that time frame is from pregnancy of the first child to the child who is 30 months old. So the parents are adjusting to the infants and encouraging their development. The nurse can provide anticipatory guidance before the birth of the infant, provide some health teaching to increase their knowledge base. The preschool age is where the oldest child is 2.5 to 6 years of age. So the parents are adapting to the needs of the preschool child in growth producing ways. So anticipatory guidance is necessary to help them as the child goes through the developmental stages, and encourage the partners at this time to make time for each other. The school age stage is where the oldest child is 7 to 12 years of age. This stage may require also some anticipatory guidance as the child moves through developmental landmarks. The nurse might provide information to enhance the knowledge base necessary for new role responsibilities. The teenage stage is where the oldest child is 13 to 20 years of age. During this stage, freedom is balanced with responsibility as teens mature and emancipate. The launching center occurs from when the first child leaves the home to when the last child leaves the home. The nurse might provide counseling to help the parents increase their capacity for self-care and coping as the children leave and the couple's relationship changes. Middle-aged parents is the next stage. That's where the nest is emptied and it ends at retirement. So the parents have to rebuild their marital bond. They might need some help with coping as the couple rebuilds their relationship and identifies mutual interests. The scope of the aging family stage runs through from retirement to moving out of the family home. These individuals are coping with loss and living alone. They're adapting to retirement. They may need counseling to help with coping. They may need to be provided with information on community resources and recreation and alternative living options. The structural family assessment considers family composition. The nurse would define the immediate family members, their names, ages, and the relationship among those who live together. And this can be illustrated through a genogram. So if you look at figure 4-6 in your textbook, you can see an example. That's on page 100 in your textbook. And then the Ecomap, which is figure 4-7 on page 101, illustrates sources of social support and family stressors. Sometimes it's helpful to create a genogram and an Ecomap for your own family. When a family functional assessment is performed, the 6 family functions that we discussed previously should be considered: affective, healthcare and physical necessities; economic resources for basic needs; reproduction needs as defined by the family; socialization and placement of children in society, as well as family coping. When we assess families for healthy characteristics, there are some questions we can ask. Is there a facilitative process of interaction among family members? Does the family enhance the development of its individual members? Are role relationships structured effectively? Does the family actively attempt to cope with problems? Does the family have a healthy home environment and lifestyle? And does the family establish regular links with the broader community? The culturogram on page 102, figure 4-8, attempts to individualize care according to the context of the culture or the ethnicity of the family. It assists in understanding the sociocultural context of the family. The culturogram includes reason for relocation if applicable, legal status, time in the community, language spoken at home and in the community, health beliefs, crisis events in the last year, holidays and special events, contact with cultural or religious institutions, values about education and work, and values about family structure. Nursing diagnosis. After the family interview and assessment are completed and analyzed, the nurse can identify family strengths and needs, or nursing diagnoses. Assessment and identification of the needs of the family are focused on the family's impact on the care and recovery of the client. By comparing the collected data about the family with the defining characteristics of NANDA, the nurse can arrive at the appropriate diagnosis for the client in the context of the family, just like for the individual. With planning as a part of nursing process, the primary intent is to define goals in relation to the care of the client. The family may benefit from these established goals. However, the primary intent is to enhance the health of the individual client. Mutual goal setting in which the client and the family are included is the cornerstone of effective planning in community-based care. Nursing interventions as a part of nursing process. Interventions may be cognitive, where they involve the act of knowing, perceiving, or understanding. They may be affective, having to do with feelings, attitudes, and values. They may be behavioral, when they have to do with skills and behaviors. They provide specific directions and a consistent, individualized approach to the client's care. They are written as instructions for others to follow. Evaluation as a part of nursing process is a joint effort of the nurse, family, and other caregivers. Is the plan successful or does it need refinement? What additional data are required to evaluate progress? Did the nursing diagnosis focus on the most important problem for this family as it relates to the potential for the client to do self-care? What other needs may this family and client have? What other strengths are apparent in this family? This is all a part of evaluation. In summary, understanding family structure, roles, and functions is essential in providing comprehensive nursing care in acute and community-based settings. Community-based nursing requires the nurse to provide care in the context of the client's family to enhance self-care. Question number 1. Applying the family functions to Maslow's hierarchy of needs, which of the following interventions would be the priority of the nurse when working with a homeless family? A. Referral and follow-up by assisting the family to find housing. B. Health teaching, parenting skills. C. Counseling regarding self-esteem issues. Or D. Health teaching the family to properly use a car seat for their infant. The answer is A. Referral and follow-up by assisting the family to find housing. The rationale is that according to Maslow, human needs must be met at the lowest level before moving to the next level. The family will want to have permanent housing secured before they will be interested in health teaching or counseling. Question number 2. Using Table 4-3, choose which family developmental task would be the focus for assessing a family with preschool children. A. Adapting to the needs of children in growth-producing ways. B. Establishing outside interests and careers. C. Rebuilding marital bond. D. Encouraging the child's achievement. The answer is A. Adapting to the needs of children in growth-producing ways. The rationale is that preschool children are curious, they have high energy, and make heavy demands on parental time and energy. This makes it difficult for couples to focus on marital bonds or have the time or energy to establish outside interests or focus on careers. Encouraging the child's achievement is always important in families, but it is more characteristic of the stage of families with school age children. And the last question is, which of the following questions is a component of a functional assessment of a family? A. Are role relationships structured appropriately? B. What is the family composition? C. Does the family have the economic resources required to provide for basic needs of the family? D. What are the ages of the children in the family? The answer is C. Does the family have the economic resources required to provide for basic needs of the family? The rationale is that the six family functions that must be considered during functional assessment are affective, healthcare and physical necessities, economics, reproduction, socialization and placement, and family coping. Through interviews, the nurse collects information about the family member's perception of how well the family is fulfilling basic functions.